Hello, I'm Jason Mazakis, providing the update from Albany Med. Today is April 1st, 2024. Joined to my right is Mr. John DiPaolo. Hi, John.
Dr.
Welcome.
Mazakis, good to be here with you today.
Happy April Fool's Day.
Thank you. It's going to be a good one.
Mr. DiPaolo joins me as the Senior Vice President for Diagnostic and Therapeutic Services. Hold that thought. We'll get to that in a little bit. But welcome, JD.
Thank you.
So as we end March and head into April, we have lots to celebrate here at Albany Med. Awesome Epic Go Live. Went really well, 4 weeks in.
Tremendous teamwork, Jason, really across the board. It was great to see clinicians, obviously IT people, administrative people, all working together to really pull off a tremendous successful Go Live.
Excellent. And I think one of the key things at this stage, we're learning a lot about the system, we're optimizing, we're working through process, and really these lessons learned are going to confer lots of valuable ideas as we roll out to our system affiliates. Exciting stuff. March we celebrated quite a bit. March was Social Work Awareness Month, and social workers are so important in the space of discharge planning and the work that they do to help our patients throughout the hospital. Also in the month of March, the Child Life Specialists were recognized for their tremendous work, especially in our children's hospital. And if you think about it, John, a Child Life Specialist is so important as we engage our patients of the youngest age, whether they're preparing for a diagnostic test in one of your areas or a surgical area. It's so important that we gain the trust of our youngest patients.
Absolutely, Jason. And having previously worked at a children's hospital, we know that pediatric patients come to the hospital a little bit more tense, and having these individuals make their care much less stressful certainly goes a long way.
Excellent. Now, March was also an important month to recognize Colorectal Cancer Awareness Month. And think about this. Colorectal cancer is the third leading cause of cancer in our nation among both men and women. And it really underscores the importance of timely screening tests, colonoscopies, etc. And I think the screening guidelines have now dropped to the age of 45 years. And so it really behooves us as individuals to go through those important tests and to avoid the complications of those horrible cancers.
No doubt, Jason. And obviously what's been in the media the last week or so definitely reinforces the fact that this is an important issue, and people need to take care of themselves and be aware of this issue.
Absolutely. Continuing on the theme of recognitions,
Yes.
We ended the month with Doctors Week, National Doctors Week. So happy Doctors Week. I truly believe that healthcare delivery here at Albany Med, like most hospitals, that delivery is truly a team effort, and it really behooves us to collaborate. There's so many examples of it in the hospital itself.
Well, Jason, I sincerely want to wish you a happy Physicians Week, happy Doctors Week, and certainly wish that to all of our physicians who do such a tremendous job in caring for our patients here at Albany
Appreciate
Med.
that,
So
John.
thank you.
And I think when I reflect on the 30 years of being a physician, I can't think of a better privilege to be able to impact on the life of another human being. It really is important. But again, I can't stress enough the fact that we rely on the help of all of our services across the entire hospital system. So teamwork is really the essence.
No doubt.
And speaking of teams, we want to talk a little bit about your team, John. I know you support us in the hospital especially. Diagnostic and Therapeutic Services. It covers quite a range of services throughout the hospital. But first, I have a quiz for you.
Yes, sir.
April 1st, so April Fool's Day 2005. What is that date in history? Why is it so important?
Well, I'm appreciative of you bringing that up. That's my work anniversary date. I've been here at Albany Medical Center now for 19 years. So
we
thank you
appreciate
for calling that out, sir.
So John did his work, originally getting his MBA and his Master's in Healthcare Administration from the University of Pittsburgh. He brings a wealth of information and fund of knowledge in the area of health system delivery. More importantly, your local knowledge here at Albany Med is so impactful. You know the entire house, and it really is helpful. It's that local knowledge that really I rely on a day-to-day basis, so I thank you for that. But let's take a little bit of a deeper dive and talk about your team. And it's quite a robust team. Communication disorders.
Yeah, it's a tremendous team, and Stacy Vanderhorst is our leader of communication disorders. She's done a tremendous job, and you know, Jason, you mentioned the recent go live with Epic and the success that we've had. You know, Stacy just stands out, done a remarkable job with the clinical documentation, and also she's followed up on some of the rev cycle components and been a leader on that front as well.
Tell me about your dietitians.
Dietitians is a great group. Amy Falk is the woman that leads our dietitians, and again, just a tremendously hardworking group, and they've really taken to Epic very, very well. In fact, I had one of the dietitians stop me in the hallway and compliment the tremendous success they're having. She basically said that, you know, this new documentation tool has made their work experience significantly better. So good stuff amongst our dietitians.
I absolutely agree. And so many of your areas are so mission critical. Lab and blood bank.
Yeah, lab and blood bank, great group. Joe Source, Dr. Subic, Anne-Marie Mullen. You know, this was one of the areas with the Epic Go Live that was sort of being looked at by Epic and telling us that laboratories typically have the most difficult Go Live implementations. And really, our lab has had a very successful Go Live, really minimal issues that have come up in terms of laboratories going live with Epic.
Tremendous. And so many of the areas support some of the medical areas to support the physicians and providers. Neurophysiology.
Yeah, neurophysiology is led by a woman, Nancy Finn, is our leader there. She's worked well with the physicians, again, working really hard in terms of bringing Epic up to speed for our neurophysiology patients. And really, again, Nancy's another one of those individuals that pays a lot of attention to revenue cycle and business matters related to management operations.
Nancy's a detailed person, that's for sure.
She sure
Appreciate
is.
her. Non-invasive cardiology.
Yeah, non-invasive cardiology, Jamie Conklin leads a good group of individuals that really pay a lot of attention to clinical services, really have worked hard on the clinical front and have done a tremendous job with our Epic Go Live.
Physical therapy, occupational therapy, both on the inpatient side and the outpatient side.
Yeah, on the inpatient side, Linda Sprague is our leader. Jason Gagnon leads the outpatient physical therapy and occupational therapy. The two of them, again, we have a strong physical therapy and occupational therapy program, both inpatient and outpatient, and it's a credit to their leadership.
Excellent. Pharmacy, and that's a huge area.
Yeah, pharmacy. Anthony DeSpirito has been our director of pharmacy services. Anthony's been with us for a few years now. And again, you know, I refer back to our Epic Go Live. We had some struggles. No one's fault, but the transition from the data coming out of our previous system into Epic. We've had some struggles with that. So, you know, it's been a time that Anthony's had to lead through some difficult circumstances, and he's done a great job. In fact, just this week, we posted our best medications turnaround time in Epic due to Anthony's efforts and our pharmacist's efforts.
And so important for impacting our care delivery. Radiology.
Yeah, radiology. Melissa Grandjean is the director of our radiology services. Again, huge department, a lot of good work being done there in radiology. The thing that stands out recently with some of the work that Melissa's done is that, you know, the Epic Go Live, I was really concerned about patients waiting in line in terms of, you know, being registered to get their radiology services. And really, every time I came through that area for registration, there were no lines at all. A lot of preparation, a lot of hard work in advance of our Epic Go Live that led to that success.
That's fantastic. And then finally, to round out the team, respiratory services.
Yeah, respiratory services is led by Maureen Dixon. And really, I give Maureen a lot of credit because in addition to respiratory, which is a large department to run, she also oversees telemetry and EKGs. And again, Maureen is a stickler for detail, works very and we pretty much had a seamless transition to our Epic Go Live.
Now that's a long list, and I will tell you, somebody has to keep you organized on a day-to-day basis. Tell me about Jill Moffitt.
Yeah, Jill Moffitt just joined Albany Medical Center. about a month ago. And Jill has always admired Albany Med, and she's really excited to be here and be part of the team. And I tell you, for a first month of being here with the organization, she'd be tough to beat in terms of her impact already in just wanting to make a difference with all of the leaders here at Albany Medical Center and supporting them.
Excellent, and so important. So finally, we had an Eye Care Award winner this past month, and I think very apropos, talking about all of the different services in our hospital, Dominique Colbert. Dominique's been with us for over 13 years, and she works as an assistant supervisor in hematology. Tremendous person, really cares so much about her fellow workers, an incredible educator, a detail person, committed to our mission. Can't think of a better recipient. And we had a really wonderful ceremony at our combined leadership meeting. Really enjoyed all of the accolades that she received and all of the well wishes from her colleagues.
Yeah, very hardworking. And when I was at that celebration, I was sitting next to Joel Kahn. He's one of the people that led our Epic Go Live. And when she got that award, Joel leaned into me and said she was instrumental in, really, you had referenced the training, all the training work that she's done, preparation work that she's done to help with the blood bank implementation of Epic.
Excellent. Last few details. April 8th. What is April 8th? April 8th is the next solar eclipse, and it's being tracked and looked at. And
It is.
I was researching this, John, and typically these eclipses can be visualized, at least in the United States, roughly every 20 years. Something else happens roughly every 20 years. We're installing our dean, Dean Boulos, a near and dear friend and colleague, and the RSVP for the installation is Friday, April 5th. That's the deadline to respond. The date of the installation is April 19th, 2 p.m. at Empire State Plaza. I am so proud to know Dr. Boulos as a friend, as a colleague, as an expert in his area of neurosurgery. I'm proud to be a part of this incredible team here at Albany Med, and certainly his leadership. He's mentored me for many, many years. So really happy to see him, and I congratulate Dr. Boulos on this amazing accomplishment.
Yeah, Dean Boulos, obviously, he's a tremendous leader, tremendous clinician, tremendous educator. We're really looking forward to that day. It's going to be a wonderful celebration and very, very well deserved.
Absolutely. Well, I think that's it, John. How do we do?
I think we did all right.
All right. Well, hope everybody has a wonderful week. Take care of yourselves. Take care of each other. Good to see you, John.
You too, sir.